meets physics. In this special feature, we journey through the restricted corridors of nuclear preparation, the delicate dance of isotopes, and the life-saving scans that follow. This is Uganda's nuclear medicine story, unfolding in silence but leaving loud impacts. Now, Mr. Mbati guides us into one of the most critical zones, the laminar flow area. Here, precision meets sterility, as every movement is calculated to protect both the medicine and the patient it's intended for.
Medicine has moved. If you see here, the paradigm shift in medicine. Medicine was previously descriptive. You just describe medicine. Now, medicine has moved to understanding of how diseases happen. Instead of giving empirical diagnosis, so people give you treatment based on disease mechanism. How does this disease happen? You may all have breast cancer, but they will have different responses to treatment. You may all have prostate cancer, they will have different responses to kidney. You may all have kidney problems, but they have different causes. So, because of that, medicine shifted. Because of shift in medicine, the structures, everything changed. So, this is where radiology is, the conventional radiology, MRI, ultrasound. You look at the structure and how it works. So for nuclear medicine, we start following from this point to see how the disease moves, changes its organ function, how different cells interact. So we inject the drug in the body of the patient. We follow this drug, how it moves up to their cellular level, and we're able to calculate different parameters. And these parameters will give us diagnosis of what the problem is. If you say, for example, a patient has a kidney problem, we're able to calculate how much blood supply goes to the kidney. We're able to calculate how much each kidney is producing urine. We're able to see which part of the kidney is totally obstructed. So for heart the same, for the brain the same, and different parts of the body. So nuclear medicine, radiation is from the patient into the body, into the equipment. In radiology, the radiation comes from the machine. It passes through the patient's body and is detected. For us, we must prescribe this radiation and administer to the body of the patient, and radiation is emitted from the patient and is detected by the equipment. So for that reasoning, because of radiation, we have to take time to understand our patients. So previously, this is how the imaging was moving. People were only looking at structures, how organs are. You just say, okay, this organ is diseased, whether chest or the brain or the bones and so on. Then the technology has now made how you can ascertain the function of each organ. You in the CT scan, interventional radiology, you see this where they were. For us, nuclear medicine now will look at how the disease works at the molecular level so that we are able to quantify the disease progression, and which can also make the physicians or the doctors to customize treatment for different conditions of the patient. Because of that, we have to come clear with the process map of how these patients must be handled. The first thing is patients are received at the reception. This is the reception point here, which you see, which I have shown you there. Then after that, patients are assessed as per their condition. If they have a bone problem, you need to know, is this bone problem due to trauma? Is it infection? Is it cancer? Is it degenerative? If they have a heart problem, you need to know the heart problem. Is it from the electrical problem of conductivity? Is it the blood vessels which are affecting? Is it the valves which are there? If it's a thyroid problem, you need to know if it's over-functioning, is the cancer, and so on for different systems. For that reasoning, it's at the reception where we must collect data from the patient. And when we collect the data from the patient, we select these patients to know which patient qualifies for what procedure. So that's why from reception, we have our patient examination room there, and we have customized different request forms for different conditions. For bone is different from the one of the thyroid. The heart one is different from the one of the brain. So, and there's no general form because every system needs different data. It also needs different radiopharmaceuticals. The drugs we're going to mix, they are differently for different conditions.
In a world where illness often hides in silence, nuclear medicine gives the body a voice, speaking through images, isotopes, and precision-guided care.
Once we have approved that this patient can actually be handled in nuclear medicine, because some patients, there are contraindications. The doctors may not know. We say, no, this patient is contraindicated for this procedure. This patient is pregnant. This patient cannot do this test. We pick a phone and call a doctor. What exactly did you want on this patient? Some of the doctors come here to explain, say, now, from the history you have given us, this is the best investigation patient must benefit from. And then from there, the patients are prepared. Once the patients are prepared, this is where the patient preparations take place and the drugs are administered. The nurses are here. They know every organ. If you are going to deal with bone, they have to tell instructions for the bone. There's a form we have for them. We have instructions which are customized for each patient. For heart, for kidney, for brain, for thyroid, liver, every instruction is separate. And our nurses are trained to understand that. So our nurses know this patient who is for liver has the following nursing care required. This patient is for kidney, has the following nursing care required. This is for the bone, following nursing care required. That's why our beds are here. You can see we have IV fluids which are sought here, emergency drugs which are handled at this position here. And then they have different demands. So they may even have a bone problem, but they may have different care, nursing care is needed for that specific. Others have infection, the nursing care will change. Others have cancer, the nursing care will change. Others have fractures which you cannot see in the simple x-rays like stress fractures, hairline fractures. The nursing care is also different. They may have kidney problems, you find the kidney, others' kidney are obstructed, others have very high pressure in the kidney, others have the kidney which is dying, others have kidney transplants, so they have different nursing care tailored for these different patients. Once we have done all this, and we must have the drug prepared for these specific patients, and these drugs are called radio-pharmaceuticals. There are two things. One drug has the radiation, which is going to move, must be detected by the equipment. The other one is the one which must tag. If I want to see the bone, I must have the one which goes to the bone. I want to see the brain, I must have the one which goes to the brain. Even if you give the one of the brain, it will not go to the bone. It will only go to the brain. Because of that, you are able to follow what now happens in the brain at this point to know how much the metabolism in the body, how much is molecular interaction with disease, how has the disease affected the function of that specific part of the brain. If it's for the bone, you have to know. If it's for the thyroid, you need to know how has the disease affected. So you check it at molecular levels. At this point here, you have to classify the degree of the disease. So, and that will give insight to the referring physician to know exactly what intervention to do.
At Mulago National Referral Hospital, this quiet science continues to redefine how we diagnose and treat the most elusive of diseases, revealing what the naked eye cannot see and guiding doctors towards clearer decisions.
We move to the room where this special drug is prepared. And this special drug must be prepared in a very confined environment. And the confined environment must be in laminar flow system. And the place has to be locked at all times for one reason: radiation safety is restricted. And when we come here, this is the area which is free. And then when we receive our radiation sources, we test them for leakage in this area here. Once we have tested them, there's no leakage, everything's clear, we move them to the room. Now, when you are going to mix the drug, you have to put, for sterility purposes, make sure you must dress up, because mixing of these drugs needs you to be very sterile. And you have to make sure you dress appropriately for infection control. You don't take infection that side. At the same time, you also don't get contamination. So once you have put on boots, you can walk inside here. So you must put on the mask. So once you put on the mask, So you must switch on the machine so that the machine sterilizes the system. It has the laser which sterilizes the system where you're going to mix the drug. So this is where the machine is. This machine is called laminar flow fluid system. So for now you see it is 0. This light you see here is not ordinary light. This light keeps this place, it's a laser. It sterilizes this environment so that you can properly prepare all your nuclear drugs in sterile environment. So you have to switch on the machine there. Once you switch on the machine, you see the pressure is rising. At the same time, the air change, meaning that the system is pumping fresh air from outside to the system. So the system extracts, if you are going to have gases which are going to come from radiation source, this gas is extracted upwards and fresh air is exchanged 42 times per minute. You can imagine it pumps in fresh air 42 times per minute. So the normal drug must be kept this side. So this normal drug is what they call pharmaceutical. The radioactive drug is what they call radioisotope. So you must mix the two so that it can actually bind together and use it to follow what happens in the patient's body. So when this radioactive drug comes, it comes in sets. You find every set has its setting. There's that vial which is there. It has its special saline which is designed from the factory. You see this one here. It comes with that. It's 5 ml. This is special bottle which has vacuum designed for that specific one. Then it has it's another sterile vial which you are supposed to use to keep the bottle safe there. So you carry this to this side. So when you are carrying them to this side, you have to sterilize them with alcohol this side. After sterilizing them with alcohol, then we have a special bottle here. This bottle is designed so that radiation cannot pass through the system. So you open this bottle. It has self-contained waste system. Every waste you do here must be thrown inside here. So you remove the cap here. You clean the top for this for sterility. You lock it in that vial. You come and clean top here. So when you will receive the nuclear drug, we'll get it from South Africa on order. And this nuclear drug comes from uranium. They process uranium to many products. Finally, we get the one we use for diagnostic purposes. Some of them are used for therapeutic, so for diagnostic purposes. We come and load it in this system. And because when you switch on the system, you must access through password, you see. So the password is here. So we have to access it through password, which I already put. That's why the system is running. Once the password is acceptable, I must now deflate the system. You see, I've deflated. It can now open. When I open, that's where the nuclear drug is loaded. The technical loaded.
Doctor, you said we are safe as it is open here?
Yeah, it is very safe here.
All right.
Because all this is lead shield. Even when it is transporting it, it's total shield. There's no problem of radiation there.
All right.
So it has been technical locked, loaded there. Once it is loaded, everything is okay. Then you have seen everything is locked. Then we close here. And closing is by pneumatic pressure and magnet. You see now, I've closed the system. There, it cannot open anymore. Now, yeah. So I must get that drug to pump it up. So when I'm going to pump it up, I should open here. When I open it here, you see now I'm going to pump the system up. You watch it here. You are going to watch it down here. Okay? You see, I've pumped it up. It's coming.
All right.
It has come up there. So once it has come up there, I must open this cap off there. Once I open the cap off, then I must load this vial in that bottle so that this saline will make the other drug to be milked. It's like the way you milk a cow. So I load this one inside there. It has loaded. Then I must load the one which has the vacuum inside. You see? From there you see it is sucking the system. So it is sucking all of this up to there. You can see the level is coming up. This is 5 mils, it's 5 mils here. Then it's going to draw air so that the system makes it dry. No nuclear reaction, no any other reaction takes place on what is on the nuclear to avoid. Have you seen the bulbs now? Bubbling. You see the bubbling part? So that means the process is totally done. I have to get the dose, use the tongs because of radiation. So I must get the dose, load it in this system there. I tell the system, measure for me the dose. It lowers it down. You see here? It's going to load it down. Load. Then I measure at this point. Because we are demonstrating, so for safety reasons, I got the old generator.
All right.
So that, so you now see the dose here. You calculate how much you're supposed to get for the patients. Once I've measured the dose, I tell the system, bring it back up from there. So I pick it there, load it back, close it properly. Here, I tell the reader, go back to your home. See? Safe. That's how it works. Now, if I want now mix different drugs, so we have different drugs for different conditions. Some are stored in the fridge, some are stored outside here. The hospital buys these drugs. You see, these drugs come in packs. Like they come like this. If you see, they have a pack of like 12. This one is needed for kidney patient who has obstruction. This one is needed for a patient of bone who has cancer. This one is needed for a patient who has liver problem. And then most of the drugs are stored in the fridge. We keep them down because the fridge has automatic temperature regulation, temperature between 0 to 4 degrees. So we keep them where they keep all those UN chemistry sorted in the chemist down there. Most of the drugs are kept there. So I pick this one and mix it in that room. Once the mixing has taken place, we get the dose. We now carry the dose to the patient there.
As Uganda invests in advanced health,
UBC, inspiring Uganda. Brought to you by
Youth, elderly, and persons with disabilities. It's time to choose our leaders. Let's show up and participate in the special interest group elections. Starting June through August this year. Your vote, your voice. My vote, my voice. This message is brought to you by the Uganda Electoral Commission.